Hi guys! So today I wanted to do a video on how it feels to be a new grad nurse. So I just graduated about 2 months ago. I've been working in my new job for over a month now, and I'm getting the sense of how it feels to be a new grad nurse. So if you watched my update videos, I have touched on certain points of what I'm going to talk about in this video, but I wanted to just do one basic video on all the feelings that I feel being a new grad nurse. So the first feeling that I've been having, and I think this is very, very normal and common, is just being overwhelmed. You know, it's a lot to take on your own patients and be responsible for them and making sure you're watching, how they're doing and assessing them, and then talking to doctors if something's not going right or if you need a new medication order. And it's so weird because I just feel like I'm so new, and it's like, am I even able to do this? Like, am I old enough to do this? No, seriously, like it is overwhelming. And I have had a few situations on my shifts where I've had to deal with really upset patients or upset family members, and it's a huge learning opportunity for me on how to communicate with someone, because I feel like I'm a pretty good communicator. But then you get in those situations where sometimes you just feel like you don't know what to say. And so I'm really learning a lot about communication and how important that is in the hospital setting. I felt like a couple times when I've maybe dealt with a family member who was upset, I've thought to myself, am I even old enough to be dealing with this situation? I am 21 years old and I am a nurse, and do I even have enough life experience to be doing this right now? But in all seriousness, I know I can handle it. I know I can do it. But sometimes I just have that thought. So overall, being a new grad nurse it's overwhelming. It is a lot to just take in and a lot of new things that I'm learning. I feel very fortunate to be working on the shift that I'm working, because there are so many nurses on that shift that have been so supportive to me, and I feel like I can go to any of them to ask them a question, and I don't feel scared to ask questions, because one, they all expect me to not know everything. Even nurses who have been nurses for 20 plus years don't know everything. So I feel very okay and open to asking questions when I need to, which I think is so important. If you are a new grad nurse or about to be a new grad nurse, or if you're just a nursing student, ask questions, because I can't tell you how many questions I ask during the shift, because I don't know everything. And the only way I'm going to learn is by finding out those answers and learning it for myself. I also kind of want to touch on the new grad nurse card. I kind of feel like I have this new grad nurse card, where if I don't know something, or I maybe made a mistake, nothing life-threatening, but maybe I didn't chart something in the right spot, or that, I kind of have this new grad nurse card, oh, I'm new, I'm sorry. But I'm really trying not to use that, but it is hard at times, because I've run into a couple situations during my shifts where maybe the night shift nurse comes on and I'm doing report, and then maybe I forgot to do something, or I didn't say something, or I did something that maybe the night shift nurse wouldn't have done, and they have, I don't want to say inappropriately, but inappropriately have kind of called me out on it. And at those times, I really want to be I'm new, I'm sorry, I didn't know, but I'm really trying to just take it in, and even if I am approached in not the nicest way for something that I've done, that I'm really trying to just let it go, learn from it, and then move on. I really think I want to do a video on how to handle situations appropriately when maybe you don't agree with something another nurse has done, because I have run into some situations where I have been called out on something in maybe a patient's room, and that just does not look very good on you, on the hospital, on the nurses, when you're in a patient's room and another nurse is telling you that you shouldn't have done something, or you did something wrong, or you missed something, and that just doesn't leave you with a good feeling, and it doesn't leave your patients with a good feeling. So anyways, that's a whole another story, but I just wanted to touch on that, because I think as a new nurse, and even an experienced nurse, you might experience this where another nurse kind of tells you that you've done something wrong or differently than they would have done. And there's definitely appropriate ways to handle those situations. I feel like I am learning so much as a new nurse, more so than you even like learn in school. And you learn a ton in school, but it's just very different like in school and real life nursing. And I just feel like I have been, boosting up my confidence by, learning new things and going through my shifts. And for example, I had a patient whose IV wasn't working and the fluids weren't going in and it was leaking. And so, we changed the dressing and it was still leaking, and the IV just needed to be changed. And so normally I would have gone to my nurse and said like, hey, can I change the IV? But instead, like now I'm like, okay, I'm just gonna go get the supplies and I'm gonna do it, which is very weird at first after you're so used to being a nursing student and following your preceptor or your nurse or your instructor, and now like you are on your own. And when I say on your own, I don't mean like you're on your own, you're in the dark, no one's gonna help you, but you're on your own. Like you have to take initiative, and that's been fun for me to kind of fill those shoes and take initiative. But I also will not do anything that I am not confident in or that I don't know how to do. I will always ask questions because I never want to compromise the safety of my patients or compromise my nursing practice. And so that is very important. And if you take one thing from this video about how I'm feeling, is just make sure you ask questions when you are a nursing student or a new grad, or even if you've been a nurse forever, ask questions. All right, guys, so I hope that gives you a little glimpse into how I've been feeling as a new grad nurse. And if you have any questions for me, leave them in the comments below. Thank you for watching this video. Give it a thumbs up and subscribe to my channel, and I'll see you next time. Bye.